All right, so today's topic is vehicle damage and patient injury. It's obviously a critical area in the personal injury world. We're going to review a couple of concepts that we talked about last week, and then we will move into the meat and potatoes. All right, so the number one thing you need to keep in mind is this concept called momentum. All right, momentum from a physics perspective is momentum equals mass times velocity. Now, so basically for the rest of the world, the larger something is and the faster it goes, the more energy it has. So pretty common sense. And maybe this, right? There we go. Now, the conservation of momentum is a law, all right? So it can't be debated. It's not like up for justification and validation. It's just the way it is, right? So the energy, calculated energy going into the collision can and will be accounted for at the outcome. Energy into a collision equals the energy coming out. So we got a great little diagram here, sort of sums it up very nicely. We have 2 units of momentum going into the car that stopped but had 0, and now they come out each having 1. Energy going in equal energy coming out. Now, a crumple zone is a zone of a car that deflects energy upon impact. The purpose of a crumple zone is to increase the amount of time it takes the car to come to a complete stop in comparison to the object it hits. By increasing the time it takes for your car to come to a stop after you hit the object, the force is spread over a longer period. And as we talked about before, acceleration is the injury arbiter, all right, the change in velocity. Acceleration is the speeding up, and negative acceleration is slowing down. All right, now let's get into the references. The issue with this topic is a lot of this research has been done, so there's not a lot of new research on it. The most recent article we're going to have is like 2006, 2007, because it's already been handled. We have this quote from Low Speed Rear Impacts and Elastic Properties of Automobiles, 1989, from the Department of Civil Engineering, University of British Columbia. It says that experimental results indicate that some vehicles can withstand a reasonable high-speed impact without significant structural damage. The resulting operant motions are marked by a lag interval followed by potentially dangerous accelerations up to speeds greater than that of the vehicle. All right, that's a key point, right? When you get, especially in a rear ender, your head is going to be a multiplier effect on the acceleration that happens to the head and the neck. Our review of accident reports indicate that a significant percentage occur with little or no accompanying vehicle damage. All right, so here's the slide. All right, let's take a quick look at this. Let's start in our upper right-hand side. We have, what is that, Lincoln, all right? Bigger cars and pickup trucks tend to be stiffer than smaller cars, so they tend to brake at a much higher level. We see that in this research project. This is by the San Diego Spine Research Society, and we can see we have 9.9 miles per hour of delta V and no damage to the car. Right, so the person in that car is going to take a real good whack. We see the other vehicles. We have a maximum of 8.6 miles an hour before the car broke in the Chrysler LeBaron. We have the Ford like Focus or something like that, 7.2 mile an hour. And then in the Honda, we're talking 7.2 miles an hour. All right, again, it creates that multiplier effect onto the spine. Continuing from Navin and Romley, as the vehicle becomes stiffer, the vehicle damage costs are reduced as less permanent deformation takes place. However, the occupant experiences a more violent ride, which increases the risk for injury. The average acceleration experienced by the occupant in the elastic, no damage vehicle would be approximately twice that of the plastic, structurally damaged vehicle. All right, that's another key concept. I'll read it again. Acceleration experienced by the occupant in the elastic, no damage vehicle would be approximately twice that of the plastic, structurally damaged vehicle. This theory implies that vehicles which do not sustain damage in low-speed impacts can produce correspondingly higher dynamic loadings on their occupants than those which plastically deform under the same or more severe impact conditions. Now, this is one of the top 2 or 3 research articles you want to have in your pocket dealing with a low-impact crash. This is from Robbins, Society of Automotive Engineers. I have this article. It's a great article. And Robbins states the amount of crusher damage received by a motor vehicle in a collision is indicative of the velocities involved from the stiffness of the motor vehicle and their objects or objects as known. However, the crush damage does not relate to the expected occupant injury. i.e. the more vehicle damage, the more chance the occupant injured is not a conclusion that can be made. In fact, it is more likely the reverse. If the occupant decelerated over a greater time distance due to a large crush resting distance, then the likelihood of injury is reduced. Robbins goes on to say, it is for this very reason that racing cars, when seen in a collision, almost appear to shed their body structure. The main outside structure of these racing cars is designed to allow for crushing and to dissipate energy in the event of a collision. So here we see heavy vehicle body damage and relatively low occupant injury rates. So the body of the racing car is sacrificed to prevent the driver injury or death. Now, my quote is, in passenger cars, it's the opposite way around. Right? The body of the occupant is sacrificed to protect the car. All right. We have this thing called the Insurance Institute for Highway Safety or whatever it is, and they rate cars on how well they survive a crash. So what they do is they rate the auto insurers now take that information and then they take that to it meets the road when they're determining your auto insurance rates. If they have a car that doesn't deform till 10 miles an hour, oh, you get lower injury insurance rates because your car's not going to break as easily. So this false reasoning is often applied by insurance adjusters, attorneys, and physicians, and frequently results in costly, unjustified litigation. Due to this litigation process, the injured parties often are not compensated, resulting in unjustified hardships to the party who has already been injured. Now, Dr. Ruth Jackson here is a pioneer. She was the first female orthopedic surgeon. And she was an orthopedic surgeon, but then they came up with the Association for Orthopedic Surgeons, and they said they wouldn't let her in. So she had to retake the boards to get into the American Academy of Orthopedic Surgeons. Wrote a book called The Cervical Syndrome, still one of the best texts out there as far as spine injuries. So we'll see what Dr. Jackson has to say. The forces which are imposed on the cervical spines of passengers colliding vehicles are tremendous. And if one attempts to calculate mathematically the amount of such forces, the results are unbelievable. The damage to the vehicles in collisions is no indication of the extent of injuries imposed on the passengers. The extent of damage to the vehicles is no way proportional to the extent of damage imposed upon the cervical spines of the passengers. Now, since you work in the PIP Collect world, you've seen how many IMEs have you seen or records reviews say, oh, the patient had a strain, right? We've all heard that hundreds of times. So Dr. Jackson writes in a book that if you have a muscle strain, it's going to heal in 3 weeks. So if your client has pain after 4 weeks, so by definition, it cannot be a muscle strain. All right, so just good information from her book. In McNabb in 1982, the amount of damage sustained by the car bears a relationship to the force applied. To take an extreme example, if the car was stuck in concrete, the damage sustained might be very great, but the occupants would not be injured because the car could not move forward. Whereas on ice, the damage to the car could be slight, but the injury sustained might be severe because of the rapid acceleration permitted. Carroll et al., 1986. The amount of damage to the automobile bears little relationship to the force applied to the cervical spines of the occupant. The acceleration of the occupant's head depends upon the force imparted, the moment of inertia of the struck vehicle, and the amount of collapse force disseminated by the coupling of the vehicle. Amos, 1986, each accident must be analyzed in its own right. Auto speed and damage are not reliable parameters. Hirsch et al., the amount of damage to the automobile may bear little relationship to the forces applied to the cervical spine and to the injury sustained by the cervical spine. Smith in 1993, the absence or presence of vehicle damage is not a reliable indicator of injury potential in rear impacts. Based upon the principle of conservation of energy, any energy which does not go into the damage of the vehicle must be converted into kinetic energy, the source of injuries for the occupant. Nordhoff and Amori, 1996. Historically, insurance claims adjusters have assumed that collision injuries correlate to the vehicle external structural damage and cost repair. The assumption that injuries relate to the amount of external vehicle damage in all types of crashes has no scientific basis. There is little correlation between neck injury and vehicle damage in the low-speed rear-end collision. Palmar and Raymakers, 1993, there was no relationship between the prognosis and the type of car or the severity of the damage it sustained. Some factors bore no relationship to the prognosis, and they included the amount of damage sustained by the vehicle. Sturzenegger, Dr. Sturzenegger's got some great stuff. And his quote here today in 1994, the amount of damage to the automobile and the speed of the cars involved in a collision bears little relationship to the injury sustained by the cervical spine. The velocities of the involved vehicles and the extent of car damage are not directly related to the forces acting on the cervical spine. Ryan et al., 1994, no statistically significant associations between crash severity and 6 months injury status was found. There was no statistically significant relationship between injury status at 6 months and either measure of crash severity, and there was no statistically significant associations between crash severity variables and injury at 6 months. Back to Dr. Sturzenegger, his next article, 1995, attempts to correlate the outcome with the extent of damage to the involved cars and their speed is previously shown to be of little prognostic value. All right, Dr. Duffy returns. All right, the myriad of dynamic variables between occupants and vehicle precludes a definition of change in velocity thresholds. All right, this was a great article. All right, this is one you should definitely get in your archives. And it's a case report about a whiplash from a low velocity bumper car collision. Right, the patient ended up having surgery, but Dr. Duffy does a great job talking about the whole physics of the situation here. So great article. You definitely want to have that in your top 10 list.
Okay.
Dr. Gunn, disability appears unrelated to the severity of the collision. The degree of damage to the vehicle is not a predictor of outcome. Poperskin, 2005, striking vehicle speeds are not related to the initial VAS scores. That's the pain scales. Striking vehicle speeds are not related to the number of days the victim will have neck pain. Striking vehicle speeds are not related to neck pain severity initially or at 1 year, visual analog scales at 1 year. There's little evidence that severity of the impact predicts the early onset of neck pain or pain at 1 year. Dr. Poperskin continues, the myriad of dynamic variables between occupants and vehicle includes a definition of change in velocity thresholds for neck injury from car collisions. This is something you'll see in accident reconstruction reports talking about, the delta V wasn't so bad, so
Yes.
it couldn't have caused a problem. Well, delta V is irrelevant. It's delta A, the acceleration, was the important one. In this study, driving a large car and being struck increases the risk of neck pain. This seems counterintuitive. Large cars are less likely to deform, and therefore more of the energy of the collision was transmitted to the occupants. Rene Caillet, in his book Whiplash Associated Diseases, simulated impacts have been studied extensively and essentially confirmed that a low-speed impact with minimal or no damage to the part of the vehicle can cause significant musculoskeletal injury to the driver's or occupant's head and neck. It has been shown that high speeds are not specifically pertinent in determining the extent of whiplash injuries sustained. Dr. Caillet continues, numerous injuries result from vehicle accidents even when the impacts are not very big and there's minimal damage to both vehicles. In many instances, a person experienced whiplash after a vehicle accident has caused little significant damage to either vehicle. Henderson, 2006, collisions between motor vehicles and the occupants of those vehicles must conform to Newton's law of motion. Historically, the argument about injury or likelihood of injury have been the domain of medical experts, albeit without any true scientific evidence on which to base an opinion. A struck vehicle will accelerate forward with or without vehicle damage. This will cause accelerations of the occupant's head and chest. Henderson continues, crashes resulting in a change of velocity of 5.97 miles per hour of the struck vehicle cause a 4.7 g acceleration of the occupant's chest and an 8.3 g acceleration of the occupant's head. Right? That's an important one, Matt. So check on that one.
Yeah.
So this is your multiplier effect. All right. So you get a 4.7 g acceleration of the chest and an 8.3 acceleration of the occupant's head.
With just
the difference between the head and chest acceleration is 3.6 Gs. This resulted in the symptoms of strain and headaches. Not all occupants react in the same manner to the same change of velocity. It is my opinion that beyond a speed change of 5 miles an hour, the risk of injury is high. The risk of injury between 3 and 5 miles an hour is a gray area that would need further exploration, and the injury cannot be ruled out.
Right, but 6 miles an hour is not
All
that
right, this is
bad.
another key article from Dr. Brault. This is one of your, again, top couple. If you look at this Dr. Sigmund here, the third guy on the list here, he is another tremendously productive author. He's got literally hundreds of articles on the topic. All right, Dr. Brault says results: approximately 29 to 38% of the subjects exposed to a 4 kilometer per hour crash and an 8 kilometer speed changes, respectively, experience whiplash symptoms, with cervical symptoms and headache predominant. So that's not a lot of speed, all right? 4 kilometers is 2.49 miles per hour, and double that so 5 miles an hour for 8 kilometers an hour. Objective clinical deficits consistent with whiplash were measured in both men and women, subjects at both 4 kilometers and 8 kilometers per hour. At 4 kilometers per hour, the duration of symptoms experienced by women was significantly longer when compared with that of men. There were no significant differences in the presence and severity of whiplash between men and women at 4 and 8 kilometers per hour, or in the duration of whiplash at 8 kilometers per hour. There was no significant difference in the presence, severity, and duration of whiplash between 4 and 8 kilometers per hour, and no pre-impact measures were predictive of whiplash associated disorder. Conclusion: empirical findings in the study contribute to establishing a causal relationship between rear end collisions and clinical signs and symptoms. I think that is it. Any questions there, Counselor? Oh, so I can talk. You can hear me, right?
I can hear you, yes.
Yeah. Okay. So, you know, you just gotta. I mean, your goal is to get everyone to realize that the emperor has no clothes here. You know, so I mean, that's the skills as the expert witness and the skills as the attorney has to make that picture clear. You know, and you know, as the old adage goes, whoever has the best pictures wins. So this is why it's really important to do a really good diagnostic workup, because now if you find objective injuries, now you have something to hang your hat on, right? I definitely understand where you're coming from in terms of, you know, oh, but, you know, if you walk into a courtroom and drop a dozen eggs, you can look at the carton. The carton's still in good shape, but there's a dozen eggs that are all scrambled, right? That's a great metaphor. Football, you know, you see two guys get hit. The helmet doesn't break, but they got a concussion, right? So you got to use these, you know, you got to use these metaphors to teach the jury what's going on. So, but it's a lot easier for the expert witness if there's a great workup. You know, if you have, you know, great meaty stuff in the exam findings, now you can really, it makes the expert witness job a lot easier. You know, I read a case that just got finished up today. The guy got hit pretty good, but he had some pre-existing injury. But we found an objective measurement on his x-rays. His bones had actually shifted 3 millimeters. Now, most people wouldn't even look at that. But, you know, because that's who we are. Now, I took his x-rays from the year before. I took his x-rays now. We found a 3 millimeter slippage in the vertebrae. And that's a lot. So that's the kind of thing. Now you take that, you add that to a discussion about, you know, eggs in a carton and, you know, football helmets, and now you can get somewhere. I'll show you a video. Someone sent me a video recently with a guy, wide receiver, like catching a ball, and some guy like hitting him from, like, steamrolling him from behind, and the head just like whips back. Yeah, but his helmet was great shape, but he had a concussion still. Yeah. Again, it's the whole case. It's the, you know, anytime it's always number one is the witness. Number one is your client. You always have a good client, but it's the exam findings. It's the witness. You got to put the whole story together. I think we've the adjusters now. They're not closed-minded. They know this is bullshit.
Well, yeah, they act like it at least.
You know, this isn't their first rodeo. I mean, come on. They've been handed a line of BS over the years, and they're still shoveling it, as you might want to say. You know, they have their agenda.
Yeah,
it's not. Yeah, and they stick to it for sure.
Yeah.
But this is what this is why we take all this training. This is why we learn. We can we can come up with some good stuff. We can hit the research. And that's the nice thing about an expert report is or a demand letter. Demand letter is a great place to put this research. I wrote an article for Mana, and I said, the days of the 1-page or 2-page demand letter are out, done. This information is the kind of stuff you put in a demand letter, and you can just hit them. Now you're going to have a dozen references here that you can just put one after the other in your demand letter and say, now you have some good juice there. Yeah, I had a case with an attorney down from the South Shore, and he got like the low ball offer. I'm like, well, send me a demand letter. He gives this like 2-page thing. I'm like, really? Are you shocked? The guy had like 5 disc injuries. He's got like a 1-page demand letter, or maybe it was a page and a half. I'm like, that doesn't work. So, as he found out. Mary, any questions from you? She's muted there, so all right, everyone. It's been a good workshop, but take these references, and these are the stuff that get, take them and put them word for word right into your demand letter. Obviously, fix the typos before you put them in. But put them in there, and if you want me to read it over for you, I'd be happy to do that. I can maybe point you in some directions, and that's that'd be my pleasure to do that for you. Especially when you have the ligament laxity cases, those are the ones you really want to beef it up with the references, because it's the higher ups at the insurance companies know about the ligament laxity, the lower ups don't, the lower downs don't. So when you put that in there, you get a ligament laxity diagnosis. From what I hear from the insurance people is that they have to reserve $60,000 when they see that ligament laxity diagnosis. So you want that diagnosis if you got it.